Good afternoon, everyone. I'm here to present an unusual presentation of Pasteurella canis keratitis in a dry eye, a case report. Beneath the surface, unraveling an unusual keratitis mystery. A 34-year-old female who came with the complaints of pain, redness, and right eye for 3 days. It was not associated with defective vision or discharge. There was no history of follow-up foreign body or trauma, exposure to chemical irritants, usage of contact lens, or PITs. She is not a known case of diabetes mellitus, hypertension, or autoimmune disease. Known case of both eye dry eye since 2019 and is on treatment with lubricants. Both eye punctal plugging was done on 2020. Her general examination, systemic examinations were within normal limits. Ocular examination. Her uncorrected visual acuity was 612 parts in both eye, which was improving to 6.9 in both eye. Her IOP was 14 and 12 mm Hg. Shimmer's chest was 3 mm and 1 mm. Nick bed was 4.6 seconds and 5.3 seconds. Tear film height was 0.17 mm and 0.2 mm in right eye and left eye. Right eye showed diffuse congestion with inferior paracentral 4x3 mm epithelial defect with 4x3 mm stromal infiltrate with 20% depth surrounding stromal haze. Rest of the findings were within normal limits. Right eye duct was free. Random blood sugar was 89. Corneal scraping was done and it was subjected to gram staining, culture, and drug sensitivity. Gram staining showed numerous gram-negative bacilli with polymorphs and epithelial cells. KOH and PDA showed node growth. Blood agar culture showed grayish-white colonies identified by using automation methodology YTEC, suggestive of Pasteurella canis. It showed sensitivity to fluoroquinolones, cephalosporins, aminoglycosides, beta-lactam antibiotics, penicillin, intermediate resistance to Tobra. It was not resistant to any of the drugs. So the diagnosis of right eye Pasteurella canis keratitis with dry eye, both a correctoconjunctivitis sicca was made. She was treated with 0.5% moxifloxacin eye drops Harley, 0.3% Toba eye drops Harley, 0.3% Toba eye drops ointment during night, 2% homemade eye drops BD, and 1% carboxymethylcellulose gel 6 times. She was on regular treatment and follow-up. After 3 months, right eye infiltrate resolved, leaving 4x3 mm opacity with 20% thinning at center with visual acuity of 6.9. She was referred to rheumatologist to rule out autoimmune diseases. The Pasteurella, a gram-negative coccobacilli, is a natural habitant of the oral flora and digestive tract of animals like dogs and cats. It is absent in the normal flora of humans. Majority of the infections are due to animal exposure. So, the various causes like hyperosmolality, floral changes, goblet cell loss, cytokine release, tear film instability are leading to keratitis in dry eye. In this article, Pasteurella canis infectious keratitis occurring in 70-year-old male who is on treatment with herpes zoster keratitis, immunocompromised. His medical treatment was ineffective, so he was subjected to PKP. This is the only article available related to P. canis keratitis. In this case, a 3-year-old boy who has a history of trauma with broomstick, he is also having contact with cats. The culture showed the growth of Pasteurella canis and it was sensitive to fluoroquinolones. Another species, Maltosida, in this patient, he has history of penetrating injury. He was also having contact with pets. Aqueous and vitreous showed the growth of Pasteurella maltosida and it was sensitive to fluoroquinolones. In this case, a 70-year-old male who is on chemotherapy, immunocompromised state, developed conjunctivitis and he is also having contact with dogs. By this case, to date, only one documented case of Pasteurella canis keratitis exists in the literature. Dry eye being the ultimate cause of keratitis and by an organism not being the normal flora of human is a very rare entity. The keratitis was also managed conservatively. Thank you.
So anything unusual in your case that you were able to manage it with medical treatment?
In this case, like we managed with medical treatment, ma'am. It got resolved after 3 months of regular treatment and follow-up.
Okay.
What about rheumatology workup? You said patient was referred, but
we referred her, sir, but she didn't come after that.
Because patient was having dry eyes, so we
Yes,
don't
yes,
know
yes.
what was the underlying cause for that.
Patient didn't turn up after that. We are suspecting rheumatoid arthritis.
What is your message to the ophthalmologists who are treating dry eye and all that in view of your finding? did you find any difficulty in after infiltrate has disappeared in treating the epithelial defect?
No, sir.
Most of the times we face that difficulty that we treat the infection, infiltrate disappear, but then persistent epithelial defect, already patient is having dry eye, plus drug toxicity and all that, so you have to do additional